I just knew something was not right.
Stephen Lordeman had his wife take him to the hospital in 2008. He'd been helping his daughter move when he started to not feel well. His heart was racing. His wife, an EMT, couldn't count his heartbeats when feeling his pulse.
I did not have a lot of pain in my chest.
Lordeman was an AFib, or atrial fibrillation, an irregular and often rapid heart rhythm.
In atrial fibrillations, the top chambers of the heart are beating erratically. And because of that, blood is not being moved efficiently from the top chamber to the bottom chamber.
AFib is fairly common, and some who experience it don't have any symptoms at all. So how can you tell if you could be an AFib?
The easiest way to tell will be to feel their pulse. And if they feel that from one pulse to the next one, and if the duration is different, then they are in AFib.
While AFib isn't usually life-threatening on its own, ignoring it could lead to more life-threatening issues like blood clots and increase the risk of heart failure or stroke.
In atrial fibrillation, the top chamber is, instead of pumping effectively, is actually quivering. So blood stays there not moving well, and as a result, blood clot can form.
So how do doctors treat AFib? There are a few ways. Medication might be enough to get the heart pumping in rhythm again. In some cases, shocking the heart might be needed.
We can either give them an electrical shock that brings it back to, that sort of reset the heart and then get it back to normal, or give them medicine to bring them back to a regular rhythm.
Many patients who experience AFib end up on blood thinners at least for some time. Age is a big factor in those who experience AFib. Other risk factors include obesity, high blood pressure, smoking, and heavy drinking.
If there is structural abnormalities, such as the top chambers are dilated, they are at increased risk. If they have issue with the valve, that could also increase the chance of having AFib in the first place.
I've experienced it twice. I've had 2 heart attacks.
Lordeman credits his MercyOne cardiology team for getting him where he is today. With a few lifestyle changes and a little cardiac rehab, he and his heart are doing great. At MercyOne Siouxland Medical Center, Katie Copple reporting.